My question is, what do the candidates intend to do different in relation to the overrepresentation of African Caribbean and Asian people in the communities with poor mental health?
Okay, can I start that one with Tim?
Can I get a bit more time to have a think about that? Is that all right?
Is anybody in a position to answer?
Yeah,
Okay.
the questioner, sorry. What do you mean by underrepresentation? Overrepresentation. Oh, sorry.
Overrepresentation, in particular in the mental health system, statistics and so forth will refer to the overrepresentation of Black people, African Caribbean and South Asian people in the mental health system. So my question is, what will you do different in relation to that?
Did everyone hear that explanation? Okay, we'll ask Peter firstly to answer.
Yeah, I would say that this is an issue we have sought to tackle over the last 3 years, because although I've been mayor for the last 3 years, the council's had new responsibilities for health. We've got the establishment of what are now called health and wellbeing boards, and they're supposed to look at the way in which all of the public agencies, led by the council, tackle the real health issues for their communities. And my colleague, the Deputy Mayor, Councillor Rory Palmer, has chaired that board, and one of the issues that he has sought to deal with is, first of all, the way in which mental health in general is a poor relative within the National Health Service, but how the mental health of many of the minority communities in the city is appallingly bad, even within a system that's, is actually letting down mental health patients as it is. And I know that he's acutely aware that there is an awful lot of work to be done to get the health service in general, but particularly the Leicestershire Partnership Trust, even aware of the scale of the issues that are out there, never mind addressing them effectively. But it is one of these issues where the council and the mayor and the deputy mayor are essentially acting as the coordinators, the people who are spurring other people on, not necessarily direct providers. It's the partnership trust that is a really big challenge for all of us, either as individuals or for us as a council.
Okay, Paul.
Thanks for the question. I think we're all concerned with mental health, but you've specifically asked about the underrepresentation.
Significant overrepresentation.
And I would want to, through the Health and Wellbeing Board, look at the causes. Why is that overrepresentation there? Is that isolation? Is it because of job insecurity? What causes that overrepresentation and that spike in mental health in that community? What I've learned about mental health, because I've experienced some of this, is as long as you start talking to somebody, and sometimes that needs to be a professional counsellor. So it depends what you're shaking your head. I'm saying this with a bit of knowledge from recent information I've heard that within the Muslim community, there's set up a specific organisation led by Muslim women to counsel within the Muslim community. So if we have members of the community able to help other members of the community understanding their needs in mental health and counselling, then you might begin to get a solution to the problem. But if someone just comes in and imposes something on you from outside, are you going to listen? So I was encouraged hearing that from within the Muslim community. Something is rising up. A Muslim woman has taken the courage, thinks on a national level, to start a counselling service within the Muslim community.
Okay, can I ask Avatar, please?
I'd have to leave this to the professionals. I mean, there are people trained to deal with mental health. They're very experienced, very well educated. They've got medical degrees. This is they're far, far better qualified to answer these questions than I would be. I would have to ask their opinion on what's gone wrong and why there's such an over-representation amongst BMEs before I could make any sort of analysis or recommendation.
Okay, Adrian?
I wonder if I can throw a question back at you, because this isn't a subject I know an awful lot about. But is this a local issue or is this a national issue? This is a national issue.
Sir, I could start to tell you about mental health if we have another 2 days.
Yeah.
But just to say, it is a national, it's local, and in response to your response after, where you talk about professionals, let's face it, some of us in here is aware of the real issue when it comes to mental health. The stigma within the Asian, the African Caribbean community is very rife. They're not seeking services until they're at crisis point. When we talk about professionals, if you're talking about professionals, they are at the stage of no return. So it's the people at the grassroots that people trust, that they can rely on, that they've got that relationship with, that is preventing them from reaching the top end. But we can talk for days, I could tell you about mental health. Thank you.
Adrian?
I think that mental health is stigmatized wherever you go, whether you're white, black, Asian, whatever. That if you're overrepresented, perhaps that means that the community is taking more care and more interest than perhaps other communities are, because they're actually bringing it to the forefront. In most communities, these things get hidden, and if you're managing to bring it to the forefront so that professionals can help, then that's got to be a positive thing. If there's a root cause that causes the Afro-Caribbean community to have more issues and more problems, then that's something that would need to be addressed, but it's not something that I can sit here and, hearing this question for the first time, be able to address with any confidence or sense, that's for sure.
Tim?
Well, I've got personal experiences with mental health issues. My mum was sectioned a few times. It's something that's a bit personal to me, so I kind of try and leave, not get too, and pour my heart out to you all. Yeah, exactly. So as for what I do, I mentioned earlier on about that direct democracy kind of tool, a polling tool. What I really want to do is use that and enable the councillors to use that to empower ordinary people to actually say and bring things like this up and actually mention, look, we need to have steps in place to stop this from happening. So then people can, and also the issue is then raised at that level, so then people know that is an issue which needs to be addressed. That's my 2 pence worth onto what I'd do.
Okay, thank you. Just a quick feedback from...
Tim, thank you for that freshness and openness, and bless you and your mum. Avatar, thank you for your honesty. The rest of you, sorry, waffle, rhetoric, not knowing enough about the subject doesn't really help. Mental health issues concern a lot of people, but particularly in the African Caribbean, not Afro-Caribbean, and particularly not just about being colourblind to issues that concern all our minorities. And let's face it, when we say BME, we're talking about black and other minorities, for example, the Irish community, and particularly where I live in Belgrave, there is a substantial hidden minority of white people. So let's get the languages right, and let's get our viewpoint a bit wider, looking at issues. But coming back now to mental health issues, there is a shocking lack of service provision right across the board when it comes to, as we've just all been hearing tonight, housing, education. So it's not just about talking to somebody, just having somebody listen to you. That might be a good start, but it's not enough. And it doesn't get any better until somebody gets into hospital, and then they get sectioned, and unfortunately for our young people, they get policed, and then they get jailed. So it is wrong, it has got to stop, and I think it's about time that anybody who's entering politics, whoever you are, I don't care what party you come from, please read up about it, please come and talk to people to find out exactly what's going on at grassroots level, so that you don't ask us about what we go through day to day to day, you actually do something about it. You do take steps, you do take action, but apart from that, thank you very much.